Since the onset of the COVID-19 pandemic, as a family physician, I've written a lot of prescriptions for people affected by COVID. I wonder if it would surprise you to learn that some of these prescriptions were for food bank deliveries, and others for rent relief, and some for emotional support. We call these social prescriptions. The global pandemic has taught us many lessons, but one of the most important, I think, is one that most of us did not see coming. In the midst of one of the greatest medical challenges that we've ever faced as a society, we're discovering that one of the more powerful solutions isn't strictly medical, it's social. And more specifically, it's addressing the social inequity in our communities. The world has expended incredible resources on sophisticated new medical research and really clever vaccines and therapeutics, and these are all vital. But we've discovered that these aren't enough. The phrase, "it takes a village," has never been more appropriate or more true. In Whistler, it took our entire community coming together to look after the health of our village. Many of you will have heard of Whistler. It's a world-famous mountain resort town in British Columbia, Canada, home to Whistler and Blackcomb Mountains. In my 20s, I drove across the country to spend a winter skiing here with friends. I'd only planned to spend a season, but 30 years later, I still call it home, and I feel incredibly fortunate to live and work here as a family physician. I have always been really passionate about the value of full-service family practice, looking after people literally from cradle to grave. And I'm passionate about the concept of embedding this care into community. The COVID-19 pandemic has really reinforced for me how important this is. Spending a season in Whistler is on a lot of people's bucket lists, and there's a lot of great reasons for this. We have 2 world-famous ski resorts, lakes, golf courses, hiking and biking trails, and breathtakingly beautiful alpine and valley scenery. And so you might envision the residents of Whistler living an active, affluent, outdoor, healthy lifestyle. And while this lifestyle may be true, there's quite a bit more to our community. As most of us are aware, with COVID-19, young people are generally less medically vulnerable. They're incredibly unlikely to be hospitalized or to die. So a place like Whistler, with a lot of young people, you might imagine would be minimally impacted by COVID, right? But what if I were to tell you that the young adults in Whistler were actually the most vulnerable because they're socially vulnerable, and that's what actually drove transmission in our community? Their housing situation and frontline work exposure put self-isolation and quarantine efforts out of reach for many, despite their best efforts. This population was hit harder than anyone had expected, and it was only through the efforts of our entire community working together that we were able to decrease virus transmission and effectively care for everyone. Imagine living in Whistler in your 20s, living your best life, skiing and snowboarding every day, having a job on the mountain, maybe as a liftie, maybe as a server in a restaurant, more realistically both, lots of friends, endless social opportunities, a vibrant nightlife, all in the backdrop of a beautiful alpine mountain resort town. There are some small trade-offs for this ideal life. Housing is incredibly expensive and really scarce. So many young people live in really dense shared accommodation, sometimes up to 15 to 20 people in a house. And their jobs are usually in the service sector and often don't pay a living wage or have benefits or paid sick days. So now imagine it's November 2020 and you're in your early 20s and you've just arrived in town and you have amazingly found accommodation in a house with, say, 11 other people, and you've secured a couple of part-time jobs, and you're just waiting for the snow to fall, the mountain to open, and your dream season to begin. Unfortunately, though, COVID case counts are rising across BC at that time, and towards the end of the month, Whistler sees its first big surge in COVID positivity. Your social life is somewhat impacted by this as you try to follow all the new rules, but the mountain is still open and you're still living your kind of modified dream. That is until the very end of the month when one of your 11 housemates tests positive for COVID. You feel fine, but public health contact tracing calls and tells you that you need to self-isolate for 14 days from the time that your housemate is no longer infectious, which will be 10 days from now. So if you continue to live in the same house, your total isolation time is 24 days. You might have 2 bathrooms, a shared kitchen, maybe even a shared bedroom. I mean, imagine the 12 of you trying to self-isolate from each other. So not unexpectedly, a few days later, 2 more housemates test positive, increasing your quarantine time to 26 days. And so it goes on, your quarantine time increasing every few days as more housemates test positive. It's pretty unlikely you've got family close by or options of housing to move into. It may be your first time away from home. What would you do in this situation? Remember that every day you don't go to work, you don't get paid. I mean, would you think about not even getting tested in the first place? Would you call the food bank? Would you look for financial assistance, for rent relief? One option you might consider would be moving into your vehicle if you have one. And while there is some romance associated with van life, in Whistler it involved using the shower and toilet facilities at our local community center, which was one of the first places to shut down at the onset of the pandemic. And van life in Whistler in November involves rain, snow, and cold. This whole scenario could and did happen several times over the course of a season. So not surprisingly, transmission in this socially vulnerable population exploded and paralyzed our community. It eventually led to the shutdown of both mountains that are pretty vital to day-to-day life for many of us and to our local economy. Ultimately, it took the entire community or village to change this situation. This experience ended up being the evolution of a natural experiment in something called social prescription, which drew our town together to not only meet our community's medical and social needs, but it actually allowed us to completely reimagine our community's healthcare. Social prescribing is a growing movement in which healthcare professionals connect people to non-medical community-based supports and services for health and well-being. Things like accessing healthy food through the food bank, or counseling for emotional support, or financial aid, or addictions supports, and many other social services. Recognizing that people's health and well-being is largely determined by a set of social, economic, and environmental factors, something which COVID has graphically highlighted, social prescribing attempts to meet these needs in a really holistic way. And it also intimately connects healthcare to community. I'd like to share how our community found success in a social prescription approach through a really simple text. Yes, the kind of text that you get on your phone. At the onset of the pandemic, our group of family physicians worked to create a safe space to see patients with COVID symptoms. You've got to remember that this was a really daunting task back then. There was a lot of associated uncertainty. So we collaborated with our health authority and municipality to set up and site a really well-ventilated trailer for this purpose. And in an attempt to minimize or decrease everybody's in-person or face-to-face time, we also took detailed histories from people over the phone prior to their in-person appointments. This made us realize that the medical issues were relatively easy for us to deal with, but we were talking with a lot of people that were really struggling with paying the rent or accommodation or groceries, or just feeling really lonely and unsupported, or even worse, living in their vehicles. And we also noted that we were giving out the contact information for community-based social services multiple times a day. So we collaborated with Whistler Community Services, a local nonprofit that manages many of Whistler's social services, including the food bank, and we agreed to put their contact information on a text that we sent patients with their appointment information. This text just asked, do you need help with rent, food, or accommodation? And we realized that just by asking the question, we seem to have decreased stigma enough to make it okay for people to ask for this help, because Whistler Community Services immediately noted a large increase in demand for their services. In the first week, their phone lines were completely overwhelmed, and food bank visits increased by over 300%. This simple text quickly developed into a model that fully embraced a social prescription approach, and it also created a partnership between our local medical team and community-based social services and nonprofits and our local government. This was just the beginning of an incredibly impactful and increasingly connected relationship. Clients were able to access the supports they needed, like food bank deliveries, rent relief, emotional support, temporary access to electronic devices that allowed them to stay connected to healthcare and to public health supports, and a 2-week supply of toiletries and personal necessities for self-isolation, which was funded by the Whistler Blackcomb Foundation. Through these collaborations, the community was eventually able to provide access to temporary, supported, safe housing for self-isolation. All of this led to a markedly different experience for people affected by COVID in subsequent waves of the pandemic. And it interestingly led to a markedly different experience for the providers of that care. Everyone involved in the care team had renewed energy and improved morale, despite much increased community transmission and massively increased workloads. I think this is because they felt part of an impactful, successful team that was really providing exceptional care. In Whistler, as in many other parts of the world, COVID disproportionately affected a really specific demographic, those with the least social capital. Many of the successes in Whistler's COVID response were due to addressing these social inequities collectively as a community. Through our inadvertent trial of social prescription, we've created collaborations between healthcare and community-based social services and nonprofits and local government, which will last long beyond COVID. We've also developed an intimate understanding of the social fabric of our community, which has not only greatly improved patient outcomes, but also provider satisfaction. And I think this really speaks to how important it is for primary care to be deeply rooted in community and in the social determinants of health. There's a word I love that reflects this concept. Ubuntu is a Zulu word which loosely translated means I am because you are, or I am because we all are. And it speaks to a common humanity and how much we all rely on and need each other. Whistler won't be okay until all of Canada is okay. And Canada won't be okay until all of Brazil and India are okay. None of us are going to be okay until all of us are okay. COVID-19 has shone a light on how family practice as a medical specialty practiced in isolation is no longer a tenable model of care. If as physicians we can only prescribe drugs, we have really limited influence. But if we can work with communities to create social prescriptions, then we can change so much more. Healthcare, economic stability, housing, they're all interconnected, and they all determine our health and well-being. And what we've demonstrated is that it truly takes a village, be that Whistler Village or the global village, to manage a pandemic and our health and well-being.